it's real. So every kid you know out there and sign up, remind them. Your mother's going to bed worried. You owe her. I mean it. You owe her. When I start talking like that at universities, they go, oh, he's pulling the mom thing on me now. You know what I mean? But it's true. Think about it. Think about it. The second thing I want to bet, this is all about choice and opportunity and freedom. I can't tell you how many people I've known through my life, I've known as a public official, and I know today, who tell me they've stuck with a dead-end job that doesn't pay very well. They've stayed in a community that they didn't want to live in, they wanted to move, for only one reason. They have health care coverage. Guess what? They're now free. They're now free to go look for a better job, to move to another community. But look how many people you know who stayed where they were in the job they did not like, were underpaid because they were scared to death. If they moved, they had a pre-existing condition or a number of other circumstances you can think of, they'd be in real trouble. The law gives folks the freedom to follow their dreams regardless of where they live or what they do, because now they will be covered no matter where they go. Remind them. And as I go around the country, the thing I find the most, I hear the most, and when I'm out trying to sell, I don't do it as well as you, the Affordable Care Act. The thing I hear when you break through is, well, I can't afford it. I just can't afford it, particularly from young people. I got my college bills to pay, I got my car, I got my rent, etc., and it's tough for them. And then all of a sudden they realize, my God, you mean I can get health insurance for less than it costs me to keep my cell phone? Seriously. And think of how many very poor people have come in, talked to you, worried that they were not going to be able to afford what, in fact, they needed, and that they would not get any help. When people find out a family of four can be making $95,000 a year and still get help, they're blown away. They have no idea. They have no idea. And so the most interesting thing for me is that the ultimate way this is going to work down the road is talking to your neighbor, finding out, my God, you got this insurance, and that's all it cost you. So the cost piece is something you can break down the barrier when you're talking to people. It's affordable. It can be affordable if the state takes advantage of the opportunity to expand Medicare under health care law. It changes everything. Many of the folks that you talk to receive a tax credit to help them buy a private insurance plan and qualify for Medicaid. Many of them could gain coverage if the remaining holdout states take advantage of the opportunity to expand. So in the states that haven't made up their minds on whether or not to expand, we should be pushing as hard as we can without relenting at all. And folks, look, the deadline for signing up for private health plans is through the marketplace is March 31st. There are a few exceptions, but the point of the matter is that we only have 11 days or 10 days left. And the bigger the number we bank, the more certain we know the ability to turn this back, no matter what happens in the Congress, no matter where this moves. The next enrollment date is in November. We've got to roll into that date strong. And so this final point I'd like to make to you is remember why you're doing this in the first place. And these last 10 days, push as hard as you can. Expanding access makes a gigantic difference. And the Affordable Care Act, like Medicare and Social Security, is like, well, let me put it this way, it's the single biggest social initiative the country has taken since, even more so than Medicare. More so than Medicaid and Medicare. This is allowing everybody to be able to have affordable health care. So look, let me close by saying that with the grace of God and the goodwill of the neighbors, as my grandfather would say, we're going to come out of March 31st with such a significant pool of people who have already signed up, with the pressure being put on governors who haven't allowed their states to take advantage of Medicaid coverage, that we're going to roll into November in a situation that many more people understand intuitively what this means. Many, many fewer are afraid that they can't afford it, and we're going to see this thing continue to roll. And so you're the ones who fuel that progress. And all I'm saying to you now is, it's an unfair thing to do, is ask more of you. Push as hard as you can these last 10 days. The higher the numbers, the more certitude that this is going to last forever. And ladies and gentlemen, this is one of those experiences. It sounds corny, that you're going to be talking about with your grandkids and great-grandkids that you were part of. You were part of putting in place that something that 20 years from now, everyone's going to wonder, what's the big deal? What's the big deal? Doesn't every country do this? So ladies and gentlemen, let me conclude with saying for the 15th time, not only do we need you, not only have you done an incredible job, but we owe you more than we can possibly pay you for doing so much as you are for the American people. Thank you very, very much for everything.